and all the srodhas are present in the hand. That means all the rasavahasrodhas, raktavahasrodhas, all are present in the hand. So this is the picture that will come, that should come to your mind. You think about an earthworm or you think about a tree. Okay, the tree has a central canal and all the layers are surrounding that. Our body is also in the same way. Koshta is something like a picture, a big, what you call a big picture. It's not picture, it's a picture, big, what you call drum, where something can be put inside. The process, it is processed, and there is an essence formed, and there are some byproducts formed. So that is Koshta. So the whole angas that takes part in this process will come under Koshtangas. But we have to think one thing. The Susruda's Koshta is different from Charaga's Koshta. Susruda is a surgeon, he cuts open. So that is his Koshta. He cuts open, so that is why he Hridunduga Pupusascha Koshta Ityavidede, that's why he do. But Charaga's Koshta is something that is different. This is something similar to Charaga's Koshta, this concept. So here the Koshtagni is there, the Ahara comes into the Koshta, it is digested, and the Annarasa is formed. This formed Annarasa is taken up by the Rasadhatu, which circulates like a conveyor belt. So Rasadhatu is just like a conveyor belt. So it goes, surrounds all over the body and comes back to its place. And this process is mediated by the Hridaya and the Vyanavayu. So this rasa, this mode of rasa supplies what you call day-to-day nourishment to the already formed dhadus. Simultaneously, there is another process that is going on, that is formation of the sthayi dhadus. So this takes 1 month according to our references. This process takes 1 month, where rasa produces the Rakta Poshakamsha. The Rakta Dhatu Agni acts on the Rakta Poshakamsha. It takes what it wants. Then produces some mala there and Ubadhadus. Then the Mamsa Poshakamsha is formed. That is acted upon by the Mamsa Dhatu Agni. Like this, the process goes on. So the Khaleka Bodhanaya or Kedara Gulyanaya happens in such a way. Kshiradadinaya happens in such a way. This is why we eat breakfast in the morning, say 7 o'clock. Around 1 o'clock in the afternoon, we start slightly trembling because that asthai rasa is reduced. So when we the trembling, because that asthai rasa is replenished. The sthai rasa, when it starts depleting, then we get lakshanas like Prayaspandanam, Rauksham, Sweda Bhava, etc. So this is a very beautiful concept. We can study Vishama Jara with this concept. You see, Sandada Jara, Ama forms in the Koshta, directly enters Rasa. So always there is fever. Ama forms, enters Rasa. But Sadada Jara, the Ashra is Rakta Dhatu. Why? Because the dosha takes Ashra in the Rakta. So Ama has to form, enter Rasa and then go to the Rakta. So there is a time gap. Tritiyaga again Mamsa. So there is again a gap. So that is why the temperature is Bhinna Sandabo Lakshate Jara is told. So this is not my input. This is from Ashtanga Sangraha. Sukshma Sukshmadaraseshu Dura Duradayeshuja. Dosha Raktadi Margeshu Chaner Alpas Chirenava. Yadi Margam Chanasesham Bhuishtam Beshaje Aviva. Tena I am Vichinna Sandabo Lakshate Jara, he says. So this is a beautiful concept. So anything in between is Madhyama Roga Marga. That is why for Madhyama Roga Marga treatment, you get lot of Shara Karma, Agni Karma, etc. Why? Because it's very difficult for medicines to reach in the Madhyama Roga Marga, Marma and all those areas. But the what you call Shaka is very easy. Koshta again, it's very easy to give medicines. But Madhyama Roga Marga, it's very what you call difficult to reach the medicines. So that is how you identify the srodhas. So the srodhas can be identified based on the what you call available doshyas that are involved. Next is the Nidana assessment. So assessing the Nidana is very important or integral for managing any disease. We usually fail to identify this because we don't ask that much. Second thing, whenever we start asking, the patients will start telling the routine things. My diet is usual as what you eat, I am also eating the same thing. So in such a way, the patient will respond. So you have to ask about the ahara, vihara, mental factors immediately preceding the illness as well as the prolonged time. For a prolonged time, say preceding 10 years, 15 years, etc. It's very important. So just like in nervous system, we ask about the short-term and long-term memory. Here we have to ask about the long-term as well as short-term exposure to nidana. That's very important. And also you have to look for the kala and the environmental factors. So let us take two cases of duodenal ulcer to understand this concept. So case one, the patient present as pitta vadaja shula. And when we assess the nidana, the patient revealed kadu, drava and shida aharas. So the treatment was given as guduchi adipad. In second patient, the patient had a pitta vada shula itself, but the nidana was kadu, legu and ruksha. So since this ruksha component came, the vidaryadi grida was given and the patient got result. So same modern condition, same dosha predominance, but different nidanas, different medicines. So why I am telling this is because such subtlety in observation will save you too much time. Because usually what we will do, we will start with Guduchi Adikashaya, then we will start with some Kama Tudarasa, etc. Then we will switch to the Grida. But in typical scenarios where the patient has good digestive power, but the patient typically tells about such Didaras, maybe the second change medicine can be Vidari Adigrida, and the patient will get very good result. And we can save too much time for the patient and money of the patient as well. So we have to apply such subtlety in observing. So same dosha predominance, same modern diagnosis, but different nidanas, different medicines. Let us take another example. A stroke we have already discussed. So here, right pakshagada, internal capsule infarct, obese and dyslipidemic patient, sandarpanajanya. So we suspect avarana. So the treatment is Taulyahara, Avaranahara Chikitsa, and the predominant drug of choice will be Shilajadu. This is another patient, right pakshagada, again internal capsule infarct, but the patient is very lean, Krisha, a coolie, hard worker, full history of Abadarpana in his life, Adi Vyayama, Bhaya, etc. Then the treatment will be Brahmana and what you call as Saumanasya Jannana treatment. So the drug of choice will be something like Kalyana Grida, etc. So the same Ayurvedic diagnosis, same modern pathology that is going on, but different therapeutic indicators and different medicines. So even a hemorrhage can happen in a Sandarpana patient. A hemorrhage can happen in a Abadarpana. So it's not like there is hemorrhage, there is blood loss, it is Dhaduksha. That is rubbish. That doesn't have any what you call help in treatment as far as my 15 years of experience that taught me. This is another example of intervertebral disc prolapse. A male aged 35, healthy habits, no concurrent morbidities, IVDP following a fall. So there is no history of Avanava, nothing is there. So the predominant presentation is Vada predominant. So the treatment is Shamana and Balya. Another patient, aged 35, constipated, Lakshanas of Pakvashya Gadavada and Udavarta are present. Spontaneous IVDP without any fall, spontaneous IVDP, Vada predominant pathology. But here, the Shodhana therapy in the form of Vasti and Shamana and Balya will be there. But here there is no role much for Vasti because the Vada Sthana doesn't have any role. The Samprapti was not initiated from the Vada Sthana. The Samprapti was initiated from an external injury. So here Shamana and Balya will be enough. But here the Samprapti is initiated from the Vada Sthana. So the Vada Sthana Chikitsa or Vastis will be effective. So in such an approach, you can identify in which patient we have to go for Vasti, which patient we can directly go for Pedichil and Kadivasti. So such approach is very important whenever you prescribe medicines. So the big question is how to assess the Nidana. So an elaborate history is very important. So long-term dietary preferences, work and other habits, environmental factors, then family details are important. Also other illnesses and other medications that are given to the patient are important. Then we can have something called as a timeline method. So that I will demonstrate. And also we can apply the concept of herd nidana, which I am going to discuss later on. So this is a model diet chart which you can take a printout and keep in your clinic. And for every patient who comes to your clinic, you can give them and ask them to fill these things. So ask them to write down the routinely used items as well as the items that was used immediately before the presentation to your clinic. And also you have to ask about regular timing, skipping of meals, overeating, all those factors has to be identified. And you should also give a daily routine chart where when the patient wakes up, how was the sleep, bowel, maturation, exercise, etc. Then I usually ask my students to draw a long timeline and mark all the things that has happened to the patient. So this is an example. So here, a 34-year-old female patient with quadriparesis since 2 years. So the patient presented to us with myopathy at the age of 32. Now, when we took the history, you look at the timeline. Age 28, the patient had obesity. Age 23, the patient developed a dyslipidemia. And age 14, the patient had thyroid enlargement. So during the long timelines, the patient had these things happening to her body. Now look at the pattern, what is going on. So there is an overall kapha medo dushti, isn't it? So this is a kapha varana janya vada prabhava that has happened. So how we identified that? We identified that based on not the clinical manifestation of quadriparesis, but we identified that based on what is going on in the patient's body throughout the time period. So this gave us an idea. Then we started asking specific questions. Then the patient told that right from her childhood, even after her marriage, she used to stay in the same place, which is near a lake where the water is stagnant. So as per our principles, stagnant water always insults kapha dosha. You may find it very absurd in this modern era, but I'm not telling that is the cause, but that may be one of the contributing factors. So we gave the patient all kapha avarana chikitsa. The patient improved, but we already told the patient we cannot cure myopathies, but the patient is still living with minimal disabilities. And every 6 to 8 months, the patient will get admitted, take a course of Basti and Chitraga Rasayana. So the patient is comfortable now. I'm not saying the patient is totally normal, the patient is comfortable. So you can use this timeline method in your practice. This is another interesting case. This female aged 38 came with a diagnosis of dermatomyositis. So typically advanced case where the patient even cannot hold the neck properly because of the neck weakness. So all the lakshanas pointed out at Lettagadavada lakshanas. But when we deepen the history, the patient gave the history of multiple induced abortions. The patient's husband is in military and he is actually very active. So after the first delivery, they don't use contraception. So she got pregnant for 6 times, and all the 6 times they aborted using some pills. So we considered Rakta as the insulting factor that initiated this pathology. So we gave Rakta chikitsa and the patient started responding very nicely. Again, I am not claiming that we have cured the patient completely, but the patient started getting immense results. But this cannot be generalized so that every dermatomyositis is Rakta. No, it's not the case. In this given patient, we consider Rakta as an initiating factor. So this is the importance of identifying patient-specific nidanas. But what we usually do is we apply the nidana in the textbook onto the patient and we try to treat the patient accordingly. So that will not give you results. So if you are not able to identify the nidanas, that is where the concept of herd nidana will come into play. We know the concept of herd immunity as per the current COVID pandemic. In the same way, you take Gujarat, you take Kerala. Gujaratis have a typical diet pattern. Keralites have a typical diet pattern. And you take the common diseases that are happening to Gujaratis and Keralites, they have their own unique common disorders. So when a group of people start using similar dietary habits, similar lifestyles, etc., they tend to get similar diseases. So, most of the times when we fail to identify the nidana in the given patient, you look at where the patient belongs to. What is the herd? What is the herd doing? So that is a nidana. Then why you get a lot of diabetes patient? Why? Because we eat a lot of carbohydrates. As a group, we Indians eat a lot of rice. So we get prameha. So you look at the herd nidana. Don't get disheartened and okay, I don't identify any nidana. It's not like that. If you're not able to identify, then it's the herd nidana that is causing. So basically, the herd nidana can be either sandarpana or apadarpana in nature. And sometimes what happens, some of the diseases can induce other diseases. So we got a patient with quadriparesis, secondarily to TB meningitis. So there the patient's predominant presentation was jwara. So what we did is we incorporated jwara chikitsa into the management of quadriparesis. Because jwara, in Sannipas jwara, there is one slogan. Vaikalyam va prayachati. So either the jwara will kill the patient, or sometimes what happens when the jwara gets relieved from the body, it may produce some permanent disabilities. So incorporating jwara chikitsa gave very good result in such case. Then Henoch Schonlin purpura in a patient with fever and diarrhea. So there also jwara sandabad raktavitam, it's told in our textbook. Everybody will say dengue fever. I'm saying it's not only dengue fever. There are a lot of scenarios where febrile manifestation can lead to bleeding. Even any severe viral infection can suppress your platelet production and the patient can end up in bleeding. So we gave the line of jwara disara treatment and the patient improved. We didn't give Raktavita chikitsa, we gave jwara chikitsa. Then you get a lot of patients with what you call peripheral neuropathy in diabetic patients. So usually that is nothing but madhumeha, and that meda kapha is causing urustamba. So you give urustamba chikitsa in such patients, you will start getting very good results. So sometimes nidanarthakara rogas can be a cause in the manifestation. Sometimes, as I already told you, Ubhadra of a Vyadhi can also happen. Then some other specific nidanas. This is an example of 2 cases of psoriasis. In one, the patient was a goldsmith. So he used to be getting exposed to a lot of toxins, including cyanide, right? So incorporating Visha chikitsa into Kushta chikitsa gave very good result. In another patient, the psoriasis was triggered by an episode of chikungunya. So in such a scenario, we incorporated jwara chikitsa into the treatment and it gave very good results. So like that, you look for subtle factors, what is going on in the patient. So that is regarding the nidana. So I emphasized the importance of assessing the nidana. If there is anything to discuss here, we can discuss, or else we can go into the final part of our session.
Hello, sir.
Yes.
Sir, I have one question.
Yes.
If the patient comes with rukshahar, means vatakar hetu, like jagran, rukshahar, too much of fasting, if he developed any granthi like fibroadenoma or fibroids, so what will be the line of treatment? Because we have to dissolve the granthi using ushna, tikta and katu aushada. So that will increase the vata. So what will be the line of treatment in this patient?
No, actually, that's not the case. You may go for some kaphahara treatment initially, but if there is too much ruksha in the nidana, definitely you go opt for thailas. There are a lot of thailas that are told in the Granthi chikitsa and even in the Arbuda chikitsa. Thailas are told. Only thing is that we are not using that. We are always looking through the modern glass that we have put on our eye. See, even in hypertension, I have given Vidaryadi Grida and the patient responded. So if you go to a modern doctor, he will tell avoid ghee, don't give ghee to hypertensive patient. That's not the case. Even in dyslipidemia, we have done Snehvana. Even in fibroid uterus, we have given Dhanandara Thaila for Snehvana, and the fibroid improved. That always depends upon the nidana and the manifestation in the patient. I hope I am clear in that.
Yes, sir. That Vidaryadi Grut was came in my mind, but I was means that will dissolve the because we need Bruhan Chikissa, so that will dissolve the Granthi. That was my question because I don't have experience, so I have asked this question whether Vidaryadi will dissolve the Granthi or we have to do.
No. That will dissolve the Granthi means that will start altering the basic pathology that is going on and what that has triggered. So one thing that you have to keep in mind is that this. I will give an example. Two patients with a fibroid mucus. Patient A only has a palpable mass. There is no excessive bleeding, etc. But patient B has excessive bleeding. Now, the treatment line will be different in both of these things. In the initial patient, we can give all these Tikshna drugs like Varanadi, etc. But in a patient who is bleeding with fibroid, we may have to go for Stambhana Chikitsa. In both the scenarios, if you assess the dosha correctly and you give the treatment, after the treatment course, the fibroid will shrink. Definitely, it will shrink. So there is no question that because in Ayurveda, we treat in a Lakshana-oriented way. In Ayurveda, the treatment modalities are designed in such a way where we have to identify the dosha based on the Lakshana in the patient, and the medicines are also designed accordingly. But in modern medicine, it is solely based on histopathology and microbiology. So that is the difference. Because both these sciences, say the epistemology of both the sciences are different. So our medicines are designed in such a way. So if you want to reduce a Granthi and the patient is Vadapadam, use Thaila. There is no issue in that. So there are so many Thailas that are processed in Grandhihara Aushadas and that they are available. Varanadi Grida is available. Induganda Grida is available. You can use that. Definitely the size will shrink. But only thing is that if you make error in the dosha assessment, it will backfire. That's all.
Okay, sir, got it. Thank you.
Okay, now we can go forward. Next is the Samprapti. This again I have already emphasized. We usually what we do, the patient underwent Vada Prabhupaka Ahara Vihara, Vada got seated in Kadi Pradesha, patient developed a Kadi Graha. This is what we do. That's not the usual scenario. The patient might have had Abhana Vaigunya. That Abhana Vaigunya might have triggered the Kadi Graha. That you will miss. Sometimes the patient might have had Arshas, and that Arshas might have triggered Abhana Vaigunya. So if you give Arshas treatment, the back pain will improve. So there are so many scenarios. So what I'm telling is that the Samprapti has to be formulated in the given patient in every clinical scenario. Don't take the Samprapti in the textbook and put on the patient and give medicine for that. You have to formulate the Samprapti in every given patient. So look at what the interactions of dosha has happened. Multiple dosha involvement can happen. There can be a lot of coexistent Sampraptis that is going on. Then sometimes there may be generalized versus localized Sampraptis that is going on. Look at the Roga Marga that is involved. And also you can look at the timeline method, because in the timeline will give you an idea what all things are going on. For example, a patient developed a dyslipidemia at the age of 25. He developed a diabetes at the age of 30. He developed obesity at the age of 40. And he developed MI in the age of 50. So what is the undergoing pathology? It's undergoing pathology is Kapha Meda, Dushti, and the resultant Avarana. And that Avarana has caused multiple complications including stroke, MI, etc. So you have to correct the baseline. So the patient gets stroke, you don't go and do Kaya Sega there. Because the underlying Dushti is Kapha Meda Dushti. Always you opt for Udvartana, Lekhana Vasti, etc. and then go for Vadahara measures. So you look at the underlying Samprapti that is going on, what is going underneath. Don't only look at the superficial picture. That is very, very important. And in the current era, I always look at the current hidden perspectives. Because, for example, Grahani Dosha. You ask patients with back pain, chronic neck pain, etc. 60% of them will have some sort of Grahani Dosha. That means burning epigastrium, recurrent altered bowel habits. For example, altered constipation and diarrhea, loose stools, etc. Then Amala Pitta features. Because our diet is predominantly containing these things which initiate Grahani and Amala Pitta. Then Abhana, I have already told, continuous sitting itself will cause Abhana Vaigunya. So don't forget Udavarta and Papashayatama. Then Rasa is also always dushita in most of the individuals because of our irregular dietary habits. So always look at rasa, then medas. Because of this, all the sandarpana that is going on now, medas is one of the prominent culprit in most of the diseases. So look at that. Then manas is again, someone asked now the relationship between diabetes and manas. Manas is related to most of the diseases. So always look for manasika karanas. That is very, very important. Look at other aspects like an asyapakarshagadi. So here the patient has IVDP and the patient has burning sensation in the lower limb. So usually lower limb is not a pitta sthana. Now why the burning sensation? You give pindadaila etc. Pittahara measures. The patient will get only temporary relief. So here the culprit is vada. There is vada pragoba in the costa or in the pakvasya and kadi pradesha. You give vasti into the vada sthana, this burning sensation will go off. So that typically indicates that it is a asyapakarshagadi. So like that we have to apply our principles in routine clinical practice. Udavarta, you see a lot of patients we have treated in the principles of Udavarta. For example, this female aged is 36. The patient came with a blepharospasm. The patient was consulting in our Shalaka department for so many months, but there was no relief. Then they came to us. So when we inquired, there was rectal arthritis and chronic constipation. We gave Arsha Chikitsa, the blepharospasm relief, because that Udavarta got taken care of. But if you go and tell this to a neurologist, he will laugh at you. But as Ayurvedic people, we treat the system as a whole. We don't see the system separately. So that this concept is very, very important. So that is regarding the Sambrati. So try to identify the Sambrati in the given patient. Next is the Roga Nirnaya, the diagnostic, how we are diagnosing the cases. So the first question is, do we need a modern diagnosis? What is your opinion? Do we need modern diagnosis? If yes, you put Y. If no, you put no. I will wind up this class within from 5 to 10 minutes. Maybe it's prolonged too much. People will be bored, sleepy.
Yes, sir.
Sometimes it is needed. Any other opinion? It's not needed. So there are a lot of no's and yes. So let us see. See, whenever we are practicing in the current era, we are supposed to have a minimum amount of clinical competence. So modern knowledge is needed. So that we should be aware of the contemporary advances in the epidemiology and diagnostics, modern investigations, and even the new age patients are well learned. So we should be able to identify their dilemmas. We should be able to address their worries. So for all these things, we should learn modern diagnosis. And also it will help you in decision making, whether to keep the patient or to refer the patient. So that is why modern diagnosis is needed. So can you tell what is this condition? What may be the most probable differential diagnosis? The patient is having a neck swelling. It is somewhat round. On palpation, it is slightly cystic. And the patient went to a traditional practitioner who gave some oil, and that oil is still there on the patient's body part. What is this condition? Any idea? I am speaking about modern now. Just now we stopped speaking Ayurveda. Now I am asking, what is a modern diagnosis? Yeah, it is cervical lymphadenopathy, that is sure. What may be the most commonest cause? I have already told it is cystic in nature. Not lipoma, it is cervical lymphadenopathy. See, this is a tubercular cold abscess, commonest presentation in our practice. So if you don't know why I told this, because I have seen, my teacher has taught me this is a tubercular cold abscess. So I palpated, it is not hard, it is not fixed, so it is not cancer. So now the only thing is it is cystic, so it may be an infection. This is a common presentation. So when you get this, you at least if it is not TB, it's okay, well and good. But you should investigate the patient for TB. So we send the patient, it was TB, and the patient underwent anti-cox treatment. This is another case where the patient came with neck pain and weakness in the upper and lower limbs. Was under Ayurvedic treatment in some other center. But when we examined, the patient had an LMN sign in the upper limb and UMN sign in the lower limb, indicating that there is some compression going on in the cervical spine. So I referred the patient, the MRI revealed a mass, the patient underwent surgery, and the patient became okay. So sometimes we should not stick for our own treatment. We should have the modern knowledge. Then only we can know whether we can keep the patient or refer the patient. So like that, there are a lot of conditions that we went through. So that is why modern diagnosis is mandatory. But only thing is that you should keep that separate in your head. Don't mix like inflammation is equal to pitta, gout is equal to manjishta. It's not like that. Then coming to Ayurveda versus modern disease, whether we have to compare Ayurveda and modern. This is also another scenario. Personally, I don't compare. I always diagnose the patient under different spectrums in Ayurveda because you take Kasa as an example. Right from infections like bronchitis, pneumonia, allergy, autoimmune, malignancies, all these modern diagnoses can present with Kasa as a predominant manifestation. So we cannot say allergic bronchitis is Vadaja Kasa. It's not like that. It always depends upon at the time of the presentation what is the dosha predominance, which is the predominant symptom. If it is Kasa, then you diagnose it under Kasa spectrum, then you start treating based on the dosha avastha. To take Jwara, lot of infections, inflammatory pathology, so all of them can present as Jwara as a predominant manifestation. So Jwara is a big spectrum that includes lot of modern diseases. Gulma is another spectrum where an abdominal colic or tumor or even inflammatory pathologies will come under the spectrum of Gulma. So Ayurvedic diseases are big spectrums and a lot of modern diagnosis will fall under. Udara is another example. See, varied diseases, modern diseases will come under the Udara spectrum because Acharya identified Udara as Utseda Samarthya. That there is distension of the abdomen. That is the main criteria where Acharya classified it as Udara. So ascites, industrial obstruction, perforation, all these three are separate pathologies if you go to a modern surgeon. But coming to Ayurveda, it all comes under the Udara spectrum. So Ayurvedic diseases are big spectrums. So don't go for one-to-one correlation. As I told earlier, rheumatoid arthritis can present in Amavada spectrum or they may present into Adarakta spectrum. So don't tell always rheumatoid arthritis is equal to Amavada is equal to Amavada areata. No, it's not like that. In some cases, whenever there is vascular involvement, the rheumatoid arthritis patient will present to you as Vadarakta and you may have to go for prescribing Vasha, Guluchadi, Panjishtadi, etc. So you identify in which spectrum the patient is presenting to you now. Then you start treating the patient. Then Avastha Nirnaya also is very important. I have already told this example of Parkinson's where usually everyone called Avarana. But here the patient had a Dadukshaya Avastha. So we gave Mamsarasa Prayoga and the patient got result. So Avastha Nirnaya is also very important after the diagnosis. Next is the Rogi Pariksha. I am not going into detail. I will just give you the importance of Prakriti. This is a usual experiment that I make my students to do. You take a glass beaker, you take a glass of water, and you take a sponge. Then you apply grease in all these three. You apply grease in the glass, you mix grease in the water, and you apply grease on the sponge. Now, if you have to take out the grease from these three substrates, can we do it with the same measure? No. So we may rub on the glass, but we cannot rub on the sponge. The sponge will get destroyed. In the same way, the same disease in different Deha Prakritis, you may have to go for different therapeutic protocols. So that is why a single disease is equal to single drug is not at all the way of Ayurvedic treatment. This is a very good clinical example. This is not my patient, but when I was in a casualty duty, I got called into this patient's room. So the patient was given cotton Jukkadi Layaba Churna for external application. The patient is typically Pitta Prakriti individual who had Sandhigata Vada with Kapha Vada predominance. But in Sandhigata Vada with Kapha Vada predominance, cotton Jukkadi is indicated. But in this patient with the Pitta predominance, that was not indicated. So the patient had all these complications. So that this is just to illustrate. I can show you the photo. That's why I told this. There are a lot of examples where an abnormal decision making has made a lot of complications in a patient. So identifying Prakriti and other patient specific parameters are very important in practice. Then the next question that will come to your mind is to differentiate between Shamana and Shodhana. So there are a lot of what do you call indicators that you can use to decide whether you should go for Shamana or Shodhana. For example, Alpa Dosha, Ega Roga Marga, Shodhana Anarha patients, recent onset disease without Ubadravas, you can go for Shamana therapy. But if it is a Bahudosha Avastha, more than one Roga Margas are involved, Balavan patient, chronic disease with Upadrava, you can go for Shodhana. Again, there are various permutations and combinations. For example, Bahudosha Avastha, but the patient is unfit for Shodhana, you may have to go for Shamana. Ega Roga Marga, but a chronic disease, you may have to go for Shodhana. So like this, there can be a lot of permutations and combinations which you can work upon. But these are some of the indicators that you can use. So at the end of this session, I will give you an example where how we can end up in a drug selection. So it should be dosha specific. It should be dusha specific. So to become dusha specific, it is better to select from the respective roga adhikaras. For example, for Rekta, you can take medicine from Rekta Vitta, Pandu, or Visarpa, or Kushta, like that. So like that, you can select medicines from the respective roga adhikaras. You look at the roga avastha. What is the koshta of the individual? What is the prakriti of the individual? What is the satmya? What is the vaya? What is the aduravala? So like this, I am just illustrating one example, that's all. So in a typical scenario of a patient with Vada Vyadhi, so dosha specificity it is Vada Kapha, Roga Adhikara is Vada Vyadhi, Roga Avastha is Nirama, Koshta is Madhyama with a good Agni, Prakriti is Vada Pradhana, Satmya, the patient is Grita Satmya, Vaya is Madhyama, and Aduravala is Madhyama. Then we can go for Gugula Grita Grita. So how I reached into this Gugula Grita Grita? Because of these indicators. So like this, whenever we diagnose any case and whenever we assess clinically, we assess for clinical parameters or therapeutic indicators which will aid you in identifying the best drug. So then you may ask, now I am prescribing without all these things and I am getting good result. It is well and good. Whatever I have told you, if you apply, then you will get more faster results because you are giving something better to what you have been giving till now. So that is what my take home message is. Anything if it is left, we can discuss. And thank all of you for your patient listening as well.